So welcome to our TBBW Virtual Tech Connect. This one is connecting in a contactless world. As you all know, here comes the word. We have pivoted during these times. And those of you who have been on these calls, you know when we say pivoted, it's time to have a little drink. To continue to offer our partners valuable content in the networking through a virtual platform. So thank you very much for joining us today. We've got a fantastic panel that Bridgette will come on and introduce for you in just a little bit, in just a few moments. I want to run through kind of the format for our discussion today very, very quickly. When we start the discussion, we will place everyone on mute. We will lock you out of unmuting yourselves just so we can be respectful to our panelists as we roll through this discussion. The best viewing mode for these Zooms, as you know, we like to keep them open so everyone can kind of see each other. So the viewing mode for these is to place presenter mode, which is up there, or speaker mode rather, up there in the top right corner. If you want to click on that, that allows you just to see the person who's speaking at that time. Unless you want to be the Partridge family, that's fine if that's what you really want to do. Please feel free to use the chat box. We will be monitoring it for any kind of questions that Jolene and Chelsea will be behind the scenes kind of grabbing questions as we go. And if we have time to get to some of those questions, we will definitely try and do that. But we do have a packed session tonight. Also, feel free to chat amongst yourselves behind the scenes. If you want a private chat with folks that you haven't seen in a while, please feel free to do that. That's always kind of fun, and that's why we leave it really open like that. Last but not least, we always stick around for a little bit after the discussion, so please feel free to stick around and have a cocktail and talk with some of our panelists a little bit more in a one-on-one atmosphere. It always tends to be a little bit of fun, and a lot of people are cooped up right now, and they're starving for that human interaction. So without any more ado, we still see some people streaming in. We will jump over to Bridgette Bello, our president or CEO. I keep on saying president. You are president and you are CEO and our publisher and queen of the world, Bridgette Bello.
Well, thank you. That's quite an intro, Jason. Queen of the world. My wine glass, you can't see it, but it does say Queen Bee, so I'll take it. Thanks to everyone for joining us today. My name is Bridgette Bello, and my official title is CEO and publisher, but I'll take Queen of the World over both of those for Tampa Bay Business and Wealth magazine. For those of you who are not familiar with, I'm guessing is not very many, but just real quickly, we are a C-suite focused publication that crosses print, digital, and normally in-person events, but we've had to pivot, everyone drink, and learn how to do the virtual events now. I will say this, we are planning, although day-by-day changes happen now, we are planning to have an in-person event next Wednesday at the Center Club, our CEO Connect, the one that we missed for Monica Hernandez. So look for that invite to be going out soon, and register quickly because we are limited on the number of people that can attend. Even though it's normally exclusive, this one is uber exclusive. So if you get invited, you should register and come if you're comfortable. Thank you to our wonderful presenting sponsors, Ecover, which, by the way, I don't know where Ben is, but I hear he might, there he is, I can see you now. He has a birthday tomorrow, so happy birthday to Ben. Acuity, who has been with us from the very beginning on this Tech Connect series, we appreciate your partnership very much. 3Bridge, same, they have been with us from the very beginning. Source One Solutions, I already talked about how Rob's company saved me yesterday, so forever grateful. And our gold sponsors, PSCU, who has been a wonderful partner, and Spirion. We're really blessed to have a wonderful lineup of people who help us put these together and deliver great content to you guys as our audience. So without further ado, let's turn it over to those presenting sponsors. And we're going to start with Sharon Rogers from Acuity. Sharon?
Thank you, Bridgette. I appreciate it. So like Bridgette just stated, my name is Sharon Rogers. I'm actually the VP of Sales for Acuity. Acuity is very proud to be a presenting sponsor of the Tampa Bay Business and Wealth Tech event today. So we really appreciate that. And Acuity is a technology company. We're founded in Tampa. We're founded and based in Tampa. We specialize in mobility services and connectivity. So we cover a gamut of things that we do for our customers. And most importantly, I'd like to take today to thank our panelists for taking the time to participate and share their insight on the adapting and navigating how they connect in this new contactless world. So I look forward to learning more and getting to know the group. Thank you.
There's that fun pause where you have to find the unmute button really next is Jose Bello, Director of Client Engagement for Three Bridge Solutions. Jose?
Thank you, guys, and thank you everyone for being here in attendance today, which I hope it'll be your last Zoom meeting of the day. If it isn't, it will probably be your most exciting one. Thank you to the other partners that have been with us from the beginning and those that have jumped on board. Thank you to TBBW and that wonderful team that's made this possible, and to this brilliant panel of experts. You're bound to learn a lot from them and hopefully make some friends. Three Bridge Solutions, ironically enough, is a convergent consulting company which specializes in talent, training, and advice for people, process, and problems. And ironically enough, we talked about this today. We were born in a moment of crisis in 2009 with a couple of former Accenture guys. And the reality is that we are very, very accustomed to getting through these moments and helping our clients through some of these difficult moments. So if you're interested in learning more about what convergent consulting is, what Three Bridge does, and how we can help you or some of your strategic alliances and partners, two ways to do that: threebridge.com, or any one of the Three Bridge team members on this call today. You can just chat them directly. Thank you very much for the opportunity.
Nice job, Jose. Thanks. I'm impressed. And finally, Robert Hessel, he is the CEO of Source One Solutions. And I don't know where he is because it must be a covert operation, but I know that it's almost 10 o'clock at night where he is. So thanks for joining us, Rob.
Yes, thank you for having me. I'm Robert Hessel, the CEO of Source One Solutions. We are an IT services company that provides managed IT services in 118 countries across the globe. And I am joining you via Zoom across the pond in Dublin, which is our newest and most recent, unfortunately delayed, opening due to the travel bans and COVID-19. But I'll be spending the majority of my time in Dublin over the next year as I oversee the new startup office here in Dublin, which will be the European headquarters due to some changes. Some of you that know me know we have offices in England, but we've decided to make Dublin the global headquarters for our EMEA businesses. So great to see you tonight. It is a little bit later here. So yeah, looking forward to a great call. And it's good to see some of your faces again. It's been a while.
Well, and if you read Rob's story, he was Mr. December for 2019. You'll know that he has an affinity for Dublin because he has an affinity for his grandma, which I think is super sweet. And you can punch me for saying that later. All right, let's get into the questions, what everybody's actually here for. We did our best to curate what was submitted by the people who were going to attend today. So hopefully we'll cover everything that you had hoped that we were. We're going to start with Ben, the birthday boy. How do you foresee this new remote world affecting the traditional face-to-face business model?
Yeah, absolutely. So I really appreciate one, having us on. Again, I'm Ben Sever, the CEO of Ecover Global. So we're actually 100% SaaS-based company. And what we've really seen is the people who are making decisions now on Zoom calls or Zoom board meetings really have to be cross-functional. It's something that our team kind of found ironic, because we actually grew over 200% recently, is that because of the fact that, social distancing, a lot of people read into that and say, all right, we have to be technology centric, and, people take social distancing as, actually moving away from being social, but kind of the new remote kind of workforce actually is forcing people to become more sociable. And that's something that, I've really pushed, my department heads to really look at. And, because right now, we want to run very lean, as do most companies, right, to avoid layoffs. So what I've really seen is, kind of a shift to, what I would call operational engineer, but someone who's both cross-functional and very communicative. Because obviously, if you are on the phone, or on Zoom trying to, either prospect business or, move business forward, it's very difficult, as it's very distracting to begin with. So obviously people who are very engaging, very energetic, and really have a full understanding of, most departments of a business is what I see, the people who are going to thrive in the kind of this new normal.
Right. Yeah, it is very different. You don't get that same interaction that you're used to face. And I, for one, am missing it. So I'm excited about next week's event. Shilen, let's talk to you for a second. Do you anticipate needs to bridge the gap for human connection, speaking of, outside of video conferencing applications?
Yeah, and thank you, Bridgette, for inviting me to this. I'm Shilen Patel. I'm the CEO of HealthAxis Group. When I saw the question, I just jokingly said, you know, I get more continuous and intense human contact than ever before. We've got 3 small kids at home, and I realized that part of my superpower was disappearing for 8-10 hours a day and then kind of rushing back in. And so now, you know, it's a lot of human connection happening at our house, and so you know, that's, you know, that aspect of it, that void has been filled a little bit. But, you know, joking aside, you know, I think that just psychologically, biologically, I feel like humans are just wired. You know, so much of what we do is around, you know, presence and contact and community. And, you know, Zoom and these things, they can do a job, but it's just, you know, I think that you know, that in-person connection is more vital. And to me, it kind of underscored by this whole experience. And I would use the analogy of, you know, back when we all used to travel, you know, sometimes you'd stay at an older hotel and you'd be there for a week and they've got like a 30-inch, like, you know, regular definition TV because they haven't updated their gear. And the first day you're like, this is weird. And then by day 2, 3, you've kind of adjusted to it. And then you go home and you see your HD TV and you're like, oh my God, you know, all these dimensions that I wasn't really, you know, observing, that kind of filtered from my mind. So I've had the opportunity to do with, you know, a couple small group type meetings where, you know, people were really kind of pushing to get back in person in these closer circles. And it was really evident that, you know, there are just layers of, you know, kind of communication and connection that occur when you're in person, and dimensions that some of us have kind of forgotten about because we're so infrequently, you know, in person doing these things. But I think we found, you know, great utility in these remote tools, but I think that in-person connection, when it all comes rushing back to us and we have the opportunity to do those things again, I think that the difference is going to be very clear. I think there's a role for these types of things, but I think person to person is still so important in business and society and everything.
Well, speaking of person to person, we'll have to celebrate when we all can see each other in person, because Shilen just celebrated his 40th birthday. So happy birthday to you as well, Shilen.
Thank you. Thank you. The party is coming when the laws allow it. So.
Jane Mason, in this month's cover of TBBW, I have a question for you. What changes are you seeing in the financial services industry that impacts everyone and the way that business is done?
Well, hi, everyone. And of course, thank you, TBBW, for a beautiful cover. And thank you for the great article. And Jolynn, your writing, I know we had a lot of back and forth, but it turned out great. And thank you so much for this opportunity. Thanks to everybody who's joined today. I am your local entrepreneur. I'm a process automation expert. And what we do is we go into companies and help them automate their processes. So one of the things I wanted to share today is in the financial services arena, which touches all of us. I think we're going to be seeing, and if you're not already seeing it, you should be, that your banks and your local federal, your credit unions, they're all talking about how you can self-serve. So there's going to be less human touch. To your points that Ben and Shilen, you have shared, everybody loves the human touch, but there's some things you don't want to touch. So if you needed, like for example, if you needed a forbearance, you lost your job, you needed a forbearance, you didn't need to talk to anybody about it. You just wanted to click that button and get that approval. So that's kind of what we're seeing. But I also see that mobile, accessible process automation has the personalized touch. So what we've been doing a lot is in our Zoom meetings, I think this pandemic has opened an opportunity for us to be more personal with everybody we're talking to. I mean, we could talk, all of us, and say, hey, did you attend that meeting with your hair on top of your head and you were in your sweats because you forgot that it was video? Or, you know, you have more of a different opportunity to go, how's it going in New York? I know you're downtown and they looted your building. So, you know, there's other things that we can talk about now instead of just the weather, that I think are personal, like how's it going with that new puppy, which I have, and you know, that type of thing. So I think there's an advantage of the situation that we're all in, and I think the automation is going to be important for everybody, because there's some of us that don't want to talk to people that should really just be responsive to us, but the get together in person is critically important when you want it. So it's really about that on-demand personal access that I think is evolving more and more every day. Like next week, we want to go, we want to do that. We want to interact with each other. A little virtual hug, right?
Absolutely. Yeah, no, I completely agree with you. And we keep saying it's humanized people, because you see their 6-year-old run across the background of the camera.
Yeah, I love it.
Wrong
When
time,
you see
right?
the dog or the husband or the wife going by, you know, it makes it much more personal.
It has. It's brought us together for sure in different ways. All right, Drew, you've been quiet down there. What is the future of medicine and telemedicine? Is the CMS waiver here to stay? Is payment parity and interstate licensing going to continue gaining traction post-COVID? That's a big question. Take it away.
Thanks, Bridget. That's a good question. A lot there to unpack. So first, thanks for the question, and thanks for having me on the panel. It's my first time with this group. It's great to be here. You've assembled such a great dynamic group of folks, and I love the format. I'm always more interested after a few drinks. At least that's what the other leaders at HealthMap would say. So it's a great format. You know, when we launched HealthMap back in 2007, you know, one of the goals, you know, then and still today is, you know, how do you best leverage technology to drive better health outcomes for patients? And we specifically focus on folks that are very vulnerable, sick, have chronic conditions. And if you think about telehealth or telemedicine, you know, different terms for, you know, really how do you exchange different types of information, medical data through some sort of electronic means to improve a patient's health. It isn't a new concept, but it's traditionally been very underutilized. And whether it's technical barriers or regulatory issues or a lack of incentives for the docs to embrace it, you know, COVID has really changed all that. You know, specifically as it relates to the waiver from CMS or the Centers for Medicare and Medicaid Services, the federal agency that administers the Medicare program for those that are not familiar with CMS. You know, due to COVID, CMS modified some of their rules to allow payment for some telehealth services so that those patients on Medicare could receive a wider range of services from their docs without having to leave their house and travel to a healthcare facility. This is, you know, from my perspective, a great example where telehealth is really being used effectively, where you don't want to have in-person contact, but you do have folks that still need routine healthcare. It's a great way to keep those vulnerable patients or those with mild symptoms, you know, in their homes and the safety of their homes, while, you know, maintaining access to, you know, the vital care that they need. And I think we'd all agree, you know, keeping more people at home, it's a great way to limit that community spread of the virus, limit exposure to other patients, staff members, et cetera, but folks still need healthcare. You know, the payment rules are a big deal. And so CMS easing those rules for reimbursement, you know, really allow those docs to treat more patients in the safety of their own homes. And, you know, whether you're on Medicare or you're in a Medicare Advantage plan or some other insurance product, you know, we see telehealth expanding in the future. And there's no doubt that, you know, COVID accelerated that. You know, just about 2 weeks ago, CMS published a new rule that expands, you know, different telehealth options, for example, for Medicare Advantage plans. So, you know, as we move forward, I think you'll see CMS, who really sets the tone for Medicare as well as the insurers, you know, trying to strike that balance between encouraging access to telehealth, but also managing, you know, what we hear as a provider's concern that that telehealth could be used to replace, you know, rather than it really should supplement in-person healthcare delivery. You know, there's some face-to-face visits and things that, you know, telehealth can be used effectively. Routine check-ins, for example, make a lot of sense. And, you know, the docs we work with really embrace telehealth for those reasons. So we definitely see an uptick as we move forward. beyond sort of like the telehealth visit, which, some of you may have done, there are other applications for telehealth or telemedicine, things like remote patient monitoring or patient education. Those things make a lot of sense. And we've seen payment policies and rules been relaxed. For example, there's some patient education that docs like to do for folks with kidney disease and for diabetes and other chronic conditions. And in the pre-COVID world, you had to go to the office to get that education for that doc to get reimbursed. And it really didn't make a lot of sense, at least in my mind, to have someone have to get to the doctor's office, wait in the waiting room to essentially watch a training video and then leave. So, we think a lot of that is changing as we move forward. Lots of good stuff at HealthMap, and to the extent anyone's interested in how we're using telehealth and how it might impact your organization, love to talk to you more, maybe after the session one-on-one, or feel free to get in touch via email. That'd be great.
Yeah, absolutely. I had the interesting experience of having to have a doctor's appointment via telehealth and watching a video to learn how to administer a new drug for something going on with me. And it was great not having to go to the office and waste an hour and a half sitting waiting for the doctor and being late for everything else the rest of the day. So I certainly will embrace it moving forward. Shilen, I didn't know if you wanted to weigh in on that specific question, and just for the benefit of everyone on the call, because we're not all in the healthcare industry, if you could start with explaining what CMS is, because it's not content management system like the rest of us probably think, and then weigh in on the question as well.
Yeah, so CMS is the Center for Medicare and Medicaid Services. So they set the policy for all of the government recipients of healthcare. And where CMS goes, a lot of times the commercial and self-funded insurance plans will follow. And I've always kind of said that in healthcare, and I've spent my whole career in healthcare IT, and it's, innovation in healthcare, it's never been a technology problem. The technology has always been way ahead of, what's possible has always been way ahead of what's done. The challenge is the rules, risk management, risk aversion, and just kind of this risk averse mentality that exists in healthcare. And so telemedicine has been around. We use we use this technology for lots of other things in our lives. Remote connection, sharing of data, all of that type of stuff. But the rules have always sort of discouraged it. First, there was, you can only, if you're a doctor in Florida, you can only take telemedicine visits in Florida. You're not licensed for somebody in New York or Wisconsin to call and do the visit. Now, sort of broken those rules down, and it's 50 states, and they've also changed the reimbursement. So from the doctor's perspective, you get, in a fee-for-service world, which is I fix what's wrong with you and I get paid for that, versus a value-based care world, which is I get compensated and rewarded for preventing something bad from happening to you. That fee-for-service world always incentivized people to say, yeah, come to my office, because that visit paid more. And so, I think the rules, this accelerated something that probably needed to happen all along. And CMS, the head of CMS, the CMS administrator, Seema Verma, she came out in a meeting last week and said she would like to make the waiver permanent. And I think it's what makes sense. Now, it really, when you think about your family doc or primary care, everybody can kind of visualize that. As you get into specialties, super specialties, it serves some better than others. So it's not universally helpful, but I think moving it to a value-based care world and improving a doctor's ability to cover more patients and a patient's ability to get care without tremendous inconvenience, I feel like we've taken a big step forward. And I think once that door has been opened, it's going to be really hard to walk back. So they just need to make sure that the doctors, the providers' incentives are there to make sure that, that they continue to embrace the model, because it wasn't, if you could get paid $100 for somebody walking into your office and $35 for somebody being on a phone call with you, it was unfortunate, but I think everybody has different incentives in play. But I'm excited about the fact, and really is, a lot of these things that we're seeing in this time of the pandemic is things that people have talked about that have been forced into action. And same with banks when we were talking about financial institutions. The obsession over a wet signature, well, all of a sudden, now it's different because you need a signature somehow, some way. So there's things changing. I think they're changing for the better. It's institutions that have been change averse and risk averse that are sort of being forced to rethink, how they serve people.
Yes, you did a very good job of avoiding saying pivot, but I'm going to say it for you.
Bridgette, you mind if
It's a massive pivot underway.
Bridgette, mind if I piggyback off that?
Absolutely, Ben.
Yeah, so no, that's one of the biggest things. So, you know, just for those of you who know, like Ecover came to market, and we actually moved into market right before COVID hit, and something that allowed us to move our total addressable market. So we were just pretty much targeting enterprise patient engagement, just doctor to provider, but something, you know, with the CMS laws and specific the Interoperability Act. So it removed information blocking. So actually for people who are SaaS based, so we consider ourselves a SaaS based suite of software. So we can actually use EHR integrators and other integrators now to plug into different specialties, to also plug into both providers and patients and host all that information in our mobile suite of software. So it, you know, from not only an actual patient accessibility standpoint, from being able to go into a doctor's office or talk to a doctor and then be able to see other critical pieces of information. Also, from the health tech standpoint, we can actually provide better software now and more robust software predicated off these rules that have changed. So that's just something that from like both sides, both just overall patient care and mobile accessibility, that it's really pushed things forward. Kind of what Shilen was alluding to. It really accelerated, you know, laws that needed to change for the betterment of everyone in the kind of health tech ecosystem.
What's the old saying? Necessity is the mother of all invention. We didn't have any choice, right? If you're not watching the chat box, there's some pretty funny chat going on in there. So if you want to smile, it's making me laugh. So Ben, just to further on that topic a little bit, and really on a virtual topic in general, building trust via Zoom is not an easy thing to do. And for those of us who are still trying to build our businesses and make sure that our lights stay on and our employees stay employed, you know, what's the best way to do that, to start a relationship and for it to be a trust-based relationship and to move forward in that sales process?
Right, that's a great question, and actually one I get a lot. One of the reasons that, you know, and kind of we're in a unique situation, right? Because, you know, we started, you know, 15 months ago, and now, you know, we have over 30 employees. So we were able to kind of scale and, you know, be very agile and build trust along the way. And so it's a lot easier to do it with, obviously, you know, a new young startup of serial entrepreneurs opposed to a large organization. So just want to make it known that, you know, our strategies might not be, you know, universally applicable. But something that, you know, that I did, you know, as kind of a leader of our organization was, and this was our kind of full transparency from the start, right? So from our interns all the way up to, you know, myself, the chairman of the board, we actually have full, like, you know, it used to be open door, but we have like open Zoom policies, right? So like in the past, I don't know, quarter, we've grown by 200%, you know, both funding and staffing wise, right? And so we've had to add an internship program, we had to add associates, we added some board members and investors. And so what we've done is literally, I guess we can, you know, coin it now, you know, open Zoom policy, right? So we've had every single person, like their training, I guess, you know, their ramp period has really been listening into investor calls, listening into what specifically we're spending the money on. We had someone actually today, we were in the Tampa Bay Wave. And so we actually had someone at day 3 listen to, we're on a cap raise of $2.5 million, and they were on our calls, which is a lot of information for, you know, someone who's like day 2, but that shows an environment of what we're all kind of, you know, alluding to now, which is psychological safety, right? And something I kind of wanted to go off of what Jane, you know, what Jane said earlier was, you know, people love the, you know, seeing kids in the background, and like even someone in, you know, someone as regulated sector as, you know, I know high tech and healthcare and also, you know, finance, that's very regulated. So to be able to, you know, be in these environments and, you know, be psychologically safe, be open, and, you know, be goofy and all this kind of stuff that is really just alluding to what someone said earlier, kind of humanizing the culture, I think is really incredible. And I know I'm a little radical when it comes to culture centric. So I kind of like standardizing everything, but something that, you know, I recommend, and what I think will probably be more standard is self-education tools. We had about a $10,000 a quarter self-education budget for all executives, and we standardized that all the way down to interns. And so every single person is Agile certified, right? Which we all know now is the most effective project management, tool to, both grow culture and, grow your software development teams. So, if you look at everyone in, our organization, they have, their certified Scrum Master, certified Scrum Product Owner. So I really think, the all-inclusive open door, now open Zoom policy, I honestly think the more radical you go, at first it might be a little uncomfortable, it might be a little overwhelming, but, I would, in my opinion, I would rather as a leader, I'd rather have an intern know everything and be a little overwhelmed because they feel a part of the mission. They feel a part of the culture. And even though, when you're not with them and they're talking in the community, they might not be able to relay exactly, all the different departments of the organization, but them even telling the story of the culture, I've seen people light up, and that's kind of something that we've taken. And I think that's how, you build trust, both in Zoom and the hybrid between Zoom and the new normal outside of Zoom.
I love that. Instead of an open door policy, an open Zoom policy. That's great advice. Thank you. Jane, part of the reason that you came to mind for a cover this month is because your company was poised and ready for something like this to happen. You not only survived, you thrived, you guys grew like crazy. So everybody else on this call is in business in one form or another. What recommendations do you have to them to work differently in this new normal, whatever that is, day to day?
Thank you for the question. From my perspective, we have an opportunity now and a little more time to be a little more introspective about our strategic goals. So our strategic goals are probably changed a little bit because we have to do the mobile access and we have to do the virtual meetings and we have to behave differently. So you also have to look at your products and services and how you're selling them and what is making a difference to your customers. So listening to that customer. Now we do work, and I know Shilen, Drew, and Ben, we're talking about healthcare, but I span healthcare and the financial services because we do process automation in both. The key thing was, how do you tell with your data, I'm a software girl, how do you tell with your data that that particular person, customer, patient, has COVID or has a family member that's COVID? So none of the EMR, EHRs, however you want to refer to it, or the financial services back office system, none of them have a provision to say, hey, this is a COVID scenario, right? So everybody is scrambling in both industries to try and automate and get access to that data because they know everybody that's COVID related has to be treated differently. Whether you're getting a forbearance or a refi or you're a patient who's got family members, all of that stuff is different. Even with telehealth, you have to get your access to the data to make sure you're understanding who you're treating and how you're treating it. And if your back office system software doesn't have the flexibility and the capability of tagging that data, I think it's really important to think like that. And one of the other people that I talked to yesterday on a Zoom meeting, he said, we totally rethought our strategic goals. And I said, well, why? What made you do that? He said, well, we need to think smaller. We need to get our niche. We need to get more traction. We really need to build a community bank versus a global bank. And I think it's because our customers need us. Not only do they need us more now than ever, they need us to be present in the community, even if it's a virtual community. So I think taking the time and taking a deep breath from a business perspective and saying, okay, everybody's working differently. Okay, so we all know that. But what are you as a company doing to get in sync with that and coordinate your strategic initiatives with that, and I'll say pivot, with that pivot, right? So I think that's where we see, and our opportunity was, we thought more about prepare for disasters and prepare for what you don't expect in your business. And that's where we targeted our process automation. So we were able to do hundreds of thousands of forbearance requests. Remember, we have 4.5 million forbearance people. in the country right now, which is huge. And now they're all going to have to get loan modifications and deferrals, and there's going to be some trouble if people aren't thinking ahead. So we just put process automation in place that facilitates that. And the same thing with healthcare. When we looked at healthcare, we said, you know what? They're going to have a backlog. They're going to shut down. They're going to focus on COVID. They're not going to do anything else. But then where's their bread and butter, right? Their bread and butter comes from the procedures that they do. So all of a sudden you've got these large hospital organizations that have backlogs of elective surgeries that they canceled, right? So you've got 3 months now of elective surgeries. So how are you going to deal with that volume? In our world, we just prepared for automating it and making it as easy as possible.
Great. Shilen, you guys had a similar situation. Do you have anything to add to that?
Yeah, and you know, as Jane mentioned, I think all, you know, everybody on this panel has you know, has a link, either you know, partial or complete to healthcare. And as startups, we probably all looked around healthcare and saw the same thing, which is that there's dinosaurs everywhere in healthcare. And so when I started this company, what I knew was that I didn't want to be one of those dinosaurs one day. So we always had this principle of continuous learning, innovation, and improvement at play. And we kind of knew that even if we had the perfect strategy for a moment in time, or the perfect plan or the perfect operation for a moment of time, wait a day, the world changes, it's not perfect anymore. So this idea of always reflecting, always asking, okay, well, what are the problems? What are the needs? And then asking, once we've done something, how did that go? Whether it's inside of our working teams, whether it's with our customers, but that idea of sort of, you know, constantly reflecting back on what worked, what didn't work, all of those, that whole mindset has come into play in a scenario that we never could have predicted. But we're doing the same thing. So we had certain decisions we made on day one of, you know, of going remote, and you know, we had to move. We had 400 people in 8 buildings, and then, you know, 2 days later we had, you know, 14 people in 8 buildings. And so we made a lot of decisions in a short period of time, and we would be struggling if we hadn't asked, you know, on a regular basis, how did that go? Did this decision work? Does this cadence work? Is this product solving the problem for the customer? And so, you know, we've had to, you know, we've had pivots inside of pivots inside of pivots, because we're asking questions all the time. That's 3 sips, by the way, if you're counting.
I'll catch up after I ask my next question. Ben, how are you leading your team during this time? What changes have you made and why?
Yeah, so something that was, it's actually, they took this from a Spotify model. So basically when we, right before COVID, we were just about, so we had all in all between, you know, advisors, full-time employees and contractors, or maybe about like 20-25. And now if you consider all of them, actually, I think about it, probably like 45, but like our internal partners in Tampa that are all working on a day-to-day basis. We were at the point where, you know, maybe it was like 7 or 8, right? And so now we're in the double-digit markers. So what I did was instead of like having, you know, individual one-on-ones or segmenting it in department heads, I segregated our 4 verticals, our 4 main verticals into, and then just pretty much had a pod leader, but I segregated our 4 verticals, which was 12 people and 3 people per pod. So something that I did was I took our 4 most senior leaders, and then had pretty much, you know, 2 deputies, lieutenants, whatever you want to call them. And so what I had to do, and it's very hard, you know, as a founder, as a leader, to pull away and you know, not be involved in all departments of an organization. But really, this kind of gave us the time to sit down. And so we had, you know, a lot of people on this call. So like, for example, really big into hiring veterans, right? So we are one of our biggest sectors, our verticals, are municipalities and DoD. So what I did was I grouped 3 veterans that we hired and said, hey, you've been with us for a year. I know this is scary, but everyone, you know, through this time needs to learn sales, you know, sales, account management, you know, not just the operation side of things. And to be honest, we're all collaborative by design. So like they end up handling that pipeline, and, you know, kind of let them go. And then so we have kind of the younger the younger people on the team, like the true millennials, we're going after kind of sole providers, and also we're going after undergraduate collegiate health. So the three millennials that were the closest to having collegiate ties, roped them into pods. So and then I did that across the organization, and we actually were going to do that just until it got back to normal. But it's actually kind of a term called self-organizing teams. And so giving that delegation, and then like really putting a market leader to drive revenue in those verticals. And so instead of and also what that did was it removes the pressure of individual quota of individuals. So it's true team quotas with subject matter experts and all vertical centric. And that's actually something that we're actually gonna take it in perpetuity past this. But I think doing that, I mean, from a trust standpoint, it kind of shows that, hey, wherever we were, whatever we built as far as training or resources, it was kind of the true test, right? Either they were going to go out and crash and burn the pipeline, or they were going to excel, and that was the right point, and that was the right move for us. And thank God we have a very blessed team. But we actually have to schedule multiple Zoom calls at certain times now, because we've already grown. We have pods inside of pods, and so pivots inside of pivots, if you will. But yeah, no, really grouping that in, and what that also does. Lastly, I mean that's what the world is now, right? It's collaborative by design, right? So that's kind of that pod ideology is what we really sought to do after all, like the open Zoom, open door policy. So once everyone knew everything, we said, all right, what were the true catalysts of each vertical, and kind of just let them leave the nest, if you will.
I want half of your energy. Drew, did you have anything that you'd like to add to that? And I can repeat the question if you need me to. Did we lose Drew?
Sorry, I was just on mute. Yeah, would you mind repeating the question?
Sure. How are you leading your team during this time? What changes have you made and why?
Yeah, it's a great question. We have we've really embraced the remote lifestyle. We've incorporated different things in our company. Whether they be Zoom happy hours, Zoom trivia nights. We've really tried to make sure that everyone feels included. In the company, it's easy to sort of get detached from the company when you're all together. We do have people that are remote across the country, so we're used to working remotely. But we've really made it a point to make sure we bring folks together, make sure that we're embracing Zoom remote technology. We've also hosted and promoted the idea of having those folks do it with their own family members. So folks have access and can use the technology for remote conferences to have game nights with their families, et cetera, just to make sure that everyone's coming together. So, inclusion's a big part of our culture and a big part of our philosophy. And we really try to embrace it. We are reopening our office on July 6th. At least that's the plan. Everyone's pretty excited. But those are really the big changes, really trying to make the culture, trying to keep our philosophy going, but just doing it remotely.
Yeah, I hesitate to say this, but we've actually been back in the office since May 4th. So when quarantine is a distant memory for us, and we were, Jody's making faces. There's 4 of us in 800 square feet. Give me a break. We're fine. So I'm going to go out of the order that I sent to the panelists, because I saw a study in between when I sent this and now, that was done by Fortune 500, and they did a survey of their Fortune 500 list and asked them a ton of questions. If you haven't seen it, it's a little terrifying, but really, really great information. And one of the things that they asked was, when do you think that 100% of your workforce will be back in the office? And the answers were like, fourth quarter, 2021, 2022, 2023, and then never. And 90% of them answered never. So the reason I want to ask you this question is because that shocked me, but I'm interested in your thoughts, and this is to the panel, and whoever wants to answer can. Your thoughts on the future state of your use of your commercial real estate, your headquarters offices, and the space utilization. Who would like to take that? Shilen, go ahead.
Yeah, I can jump into that. So like I said, we have 3 offices in Tampa. We've got 5 offices in other parts of the country, Jacksonville, Texas, Utah. So we had people, you know, everywhere, and it was a really big conversation for us because all those spaces were saturated. What are we going to do next? You know, what's our space planning situation going to be? We're hoping to be 2-3 times the size that we currently are. And just like you, we ask questions of the people who are working from home, and there are some jobs that are really hard to do at home. I mean, we have things where you have to print hundreds of pages and mail documents and things like that for health plan clients, and that's hard to do on your home printer, and you know, to keep the process secure. But for a lot of other people, again, you know, it was the same as we've talked about before. Conversations that we had that have sort of been forced into action because of these circumstances. We had talked about hoteling. We had talked about more remote work policies. We had talked about what metrics we needed in place to know that people were doing the right things when they weren't, you know, within sight of their supervisors. And we were forced to put those into play, and it worked incredibly well with some people and less well with others. But I think what we saw is that there are some people who might never need to come back in the office. There are some people who can come back once in a while, and there are some people who are really going to struggle if they're not sitting there with physical nexus to the teams, the facilities, all of those types of things. So our hope coming out of this is that we can double our headcount, and through, you know, effective space planning and use of remote work, not have to grab another square foot of space, and hopefully even be able to kind of divest a lease or two. So it's been eye-opening for us because a lot of things that we were afraid of, we had to jump into with both feet, and it's impacted, it's changed our planning.
Jane, anything you'd like to add to that?
Well, for us, we had this surprising response to June 15th, where we said we had made all the changes in the office to make sure everybody was 6 feet apart, and we kind of broke down the break room so there was not a lot of gathering and et cetera. What we saw is we made it voluntary, and it was very surprising how many people came in. I thought a lot of us love working from home, right? It's hard to get me off the beach. So I think that there's a certain amount of a hybrid approach that we all can adopt in the future. And I think that to your point, Shilen, some people work really, really well at home, but some people don't have the environment at home to get stuff done because there's 3 kids, 4 dogs, and a lot of activity, right? So right. So some people come to work for a sanctuary and for a different type of interaction. So we're just going to offer both. And I think that that's the way we're going to approach it. And we're going to continue to be conservative in our approach to making anything mandatory, because I feel like, you know, even the restaurant closings in St. Pete and South Tampa, it just keeps you aware and a little bit on edge. And I think we all should be there. And I think we should be conservative and let some of your team members make their own decisions, but obviously with us as the executives leading what's okay and what's not okay, and how to, you know, implement the disciplines and make sure that what's happening is the right way to interact, so that they don't fall back into the old habits of, hey, everybody's sitting around on the couches talking. Well, no, the couches have been removed. So you got to come up with a little bit different approach. So, and we don't want to be disciplinarians, but we do have to enforce the guidelines, right? It's important for everybody. So I believe in a hybrid approach. I do believe everybody should be looking at their leases and looking at different, better ways of managing the space that they have, and the leases that they have, and the contractual commitments that they are currently involved in.
So just to clarify, are you saying that you were surprised by the number of people who voluntarily came to the office?
Yes.
Okay.
I thought everybody was enjoying it, because we have our Zoom happy hours. We have cooking classes together. I've never seen half the people, like, and don't take this the wrong way, but some of our developers are not the people I would think would be in the kitchen, you know, cooking. And we did a Thai cooking class, and we all made these dumplings and everything, and it was fun. It was really great. And we're talking about expanding that to our user base, you know, our customers, to get them involved. So it's working from a culture perspective, and I think the flexible work environment and the ability to make your own decision is okay for right now.
Yeah, I don't disagree with you. We certainly made the most out of ours too. We Zoom happy houred every day just to catch up on each other's day and
Right.
all of that. But as soon as the governor said we could go back, we like ran, not walked. I mean,
Right.
miss the office camaraderie and, you know, being able to yell at each other across the room and just ask a question instead of having to go through a process to get there.
Yeah,
So,
don't you miss that?
yeah, not anymore, but I was missing it for sure. Ben or Drew, anything you'd like to add to that question? And I can repeat it if you need me to.
No, I think this is the only thing I would add is, you know, people have special circumstances. So, you know, I think like what Jane said, we had a lot of people that really want to get back to work. So we are planning to open up July 6th. People are craving to get back and have the camaraderie. So that's good. I think we're doing a good job at creating a good culture and environment. But, you know, I think it's important, and, you know, we spend a lot of time. We've got a committee we established with our VP of HR just to make sure that we've got the resources in place. You know, folks have significant others or parents or others that might have health conditions and they've got a lot of concerns. So I think it's important just to try to accommodate, you know, those folks, especially the people you have make the company, and we really want to make sure that we can retain those great folks. So we have gone through some exercises to try to create some special accommodations for those folks until they get a level of comfort. And I just think that's important for people to keep in mind.
Awesome. And yeah, Bridgette, I can add on to that. One last thing is, yeah, I mean, to be honest, I think, I didn't realize this before, but I think a lot of the panelists here, I mean, you know, the reason that people want to come into the office and the reason that like people are shocked, or I think, is because everyone who really like lasted through this, you know, was culture centric by design. I mean, I can say from, you know, being a career technologist, Jane, developers cooking in the kitchen, that's not a real thing. So like that, yeah, so like hats off. Like I need to learn from you after this. We got to talk about that, because I don't even have my head of HR dancing in the kitchen. So we should probably like talk about that. But no, but on a serious level, what you know, what I really see, you know, us using it, and granted, like, you know, we're really only have a massive presence, you know, here in one other big metro city. Is that we're really using, you know, our space for really like kind of community events. And I know like that, you know, that's kind of, you know, I know Bridgette's been to a couple of them, but like a lot of, you know, kind of culture centric now is, in my opinion, it's going outside of not just your actual company's culture, but really understanding the corporate landscape, right? I mean, Tampa is, you know, it's a little big city. Everyone is 2 or 3 people away from anyone else. So you, in my opinion, like Tampa's a place where you have to give date before you ask and where you get back from it, right? So it's like our workspace, you know, our corporate entity, you know, we're out of the wave now, and we'll probably move to Embark and maybe have a couple other hubs. But we've all agreed that we're not, you know, even though that a lot of us are very autonomous and we can work remote, we're gonna use that for, you know, kind of new hire, showing actually people in person kind of the culture, but mainly, you know, throwing, you know, fundraising events, you know, mainly throwing like culture driven events, to really get ingrained in the community, not so much actually using it as like an internal, you know, I guess, you know, place to go work. And I think that's kind of I think that is kind of the model now, because, you know, co-working spaces are booming now, right? And so the whole reason that you'd want to be a part of a co-working space is like not necessarily, you know, to just, you know, be around other people or to have cheap rent, but it's to really get involved in other initiatives, right? So that's, you know, the space that we do have, you know, we're more so, we're thinking about actually doing a 25-75 approach where, you know, 25% of the time that we're there is for internal team usage, but the other 75 is to get involved in the community, and more so through like strategic initiatives. So.
All right, this one's going to be a lightning round. I'm going to limit each of you to like a sentence. We do have some live questions coming in, and I want to have time for those and be respectful of everyone's commitment that we would be done by 5:30. So, Jane, I'm going to pick on you since you said OGs. What is your -- connection tip, please?
Be real. Just be as real as you can be, and be honest with what your situation is. And I think it's really, it's an important opportunity for us to connect with each other, because we all really truly are in different situations in different parts of the country and with your families. So I think it's that sensibility, and to make it one sentence, be real.
Good job. Shilen?
Yeah, I would definitely echo what Jane said. You just kind of have to own the novelty of what's going on and use it as a point of connection. The other thing that I learned, I was not comfortable always being on video, especially early in the morning, because I would still have my bed head or whatever. And a friend of mine told me that you need a nice bulky pair of headphones to put over your head, and then people can tell how messed up your hair is. So that would be my number 2 connection tip.
Ben?
So understand your audience and always provide value to them before you derive it out of them.
I love it. That's awesome. Drew?
I think just really listening. It's a weird time for everyone. Everyone's a little bit different. It's hard to put yourself in other people's shoes. And if you just sort of take a pause and listen, you'll learn a lot about the folks that make up the company and the culture and what works and what doesn't. You get a lot of great ideas. So, really just taking a moment to listen and process.
Fantastic. All right. So Robert Hessel, all the way from Dublin, has a question, and I'm going to let him ask it live since it's like 11 o'clock there. It should be entertaining. And there goes the wine.
That wasn't my wine bottle. Don't worry. So I just, in this whole work from remote scenario, which thankfully a lot of companies have pulled it off incredibly successfully, and that's a great thing. But do you foresee in the future, and this is to anybody on the panel, do you really foresee in the future when the world goes back to normal and we're not locked down into a house where there's nothing else to do, that your employees are going to get on the phone and do cooking classes with each other through a Zoom call? I mean, the reality of it is right now it's very easy to get participation through a Zoom activity because there's absolutely nothing else to do. I think my opinion is it'll be very difficult to get people to engage like that when the world returns back to normal. I mean, good luck getting me on a Zoom call at 11 o'clock in Ireland to chat and get some human interaction. I think we all need to be cognizant of that and ask ourselves, how do we maintain the culture both back at the office and if this ever happens again and we go away, because they're 2 completely different things. At least that's how I feel that's how I feel we have to look at it and what my experience will be on this and knowing how I act anyway. So I'm curious about the panel's input on that.
Yeah, I would agree with you that there are certain things about this moment that, God willing, that will never be replicated again in terms of circumstances. And, normally you'd have people on planes, people who have to take their, kids to sporting events and, or they're commuting or whatever. And so, yeah, I personally, I think there's time that I've been able to make for experiences and events and things that just wouldn't have been, practical before. But for us also, we have people in a lot of locations already. So even when people are back in buildings and stuff, we do need to think about what worked here in terms of connecting people to one another. And, maybe the trade-off is, that, people have proven that they're good at getting work done on their own time. So maybe you do something during the workday. So instead of it being something where you're trying to take from their evening, well, gosh, yeah, I'll take a break at 2 p.m. if I don't have a meeting to go do, some fun Zoom event or something with people in Texas and people in Utah and people in Jacksonville. So I think you definitely need to reflect on what worked and why. And the why is really important because you're right. People are not going to be fixed in one place the way that they are forever, hopefully. But I think there's going to be some wins and some successes that we look at and say, we need to do this every month. We need to do this every quarter. And then there's other things that we're going to say, well, yeah, that was just a moment in time. And I'm not sure that we're going to be able to get that level of engagement around this type of activity anymore. But I think it's a thoughtful reflection on what worked, but also more importantly, why. Was it a product of the moment, or was it just something that you weren't doing before because you took it for granted?
Fantastic answer.
Yeah, Robert, I think that's a phenomenal question, and it's something that we've talked about a lot. And so it's all about, I honestly don't think, it's kind of reframing it. It's not necessarily about the expectation of, can you really expect people, to do that type of thing? I think that comes from the top down, right? You should set the expectation, and a realistic one, of are those people, tap dancing and doing cooking classes? Is that conducive to, to your product or service, right? So like, for example, I'm in a, young, hot, tech startup, right? So like, I would never want to hire someone that wouldn't want to do that naturally, right? But also, a lot of our mentors, a lot of our advisory board, it's from Bain, McKinsey, Deloitte, KPMG. It would be absurd to think that after the pandemic, they would even, want to show up. I think they're way too busy. You know what I mean? So it's like, I think it comes from the top down, setting the expectation of what's conducive to, the roadmap of your company. And so we've done something, and I think this is awesome to see, is we've co-created cultural expectations. So like, developers after this, Jane, to be honest, I hate to break it to you, but they probably won't be doing somersaults in the kitchen, right? But like, that's not their job. Like, they need to pump out lines of code, right? So it's like, I'm not expert at any means. I've been always a big advocate of culture. It's I think it's more so setting realistic expectations and then kind of co-creating, both leadership, and just employees kind of co-creating what's realistic, in tandem there. But yeah, I think that was a great question.
So I'm going to pause everybody really quickly. I know that's not fair to the other two panelists, but I want to be fair to everybody on the call. We did say that we would finish at 5:30. If you've been on a TBBW Virtual Connect before, you know that we're going to continue to hang out. You guys are going to be able to ask your questions yourselves, and there will be wine and fun and networking and hilarious chat usually. But I do want to let everybody off the hook that needs to go. And I want to do that by thanking our presenting sponsors, Ecover, Acuity, and 3Bridge Technologies, as well as Source One Solutions, all the way from Dublin. Our gold sponsors, PSCU, leave it to me, and Spirion. Our panelists, Shilen Patel with HealthAxis Group, Andrew Wall with HealthMap Solutions, Ben Sever with Ecover Global, and Jane Mason with Clarifire. If you're not already subscribed to TBBW's what has become twice a week e-newsletter now, it's normally once a week. You can sign up for that on our website. We would also appreciate if you'd follow us on Instagram, Facebook, Twitter, and LinkedIn. And now everybody can talk, because I'm all done talking, and take it from here. Jane, if you would like to answer that question that Rob asked.